All right, and so I just wanted to welcome everyone and thank you for joining us today. I know there was some confusion. Originally, this event was scheduled for a Zoom meeting and then was switched over to a Teams meeting just this past week. So sorry for any confusion on that front. I also just released a second poll question, so hopefully you are able to see that now on your screen. The first poll was just asking, are you familiar with NC HealthConnex? And the second one said, are you familiar with HIE Medicaid services? And let me, it just needs, oh, hmm, there he is. Okay, so this is just an overview of what we will cover today. Basically, an overview of NC HealthConnex. What does the law mandate? Some of our value-added services, training that you might find helpful, a demo of the clinical portal, as well as a program overview of the HIE Medicaid services, and along with program updates for the HMS. And we'll finish with questions. So before we get started, I wanted to review some housekeeping items. We ask that you do not use the chat function of this meeting. Of course, I think some of the poll questions will appear there, so feel free to use it for that, but try not to ask any questions within the chat. If you do have questions, we ask that you utilize the Q&A feature located at the top of your screen, or I believe that's the view in which you will see it. It's highlighted here on this slide in number 1. And if you click the Q&A icon, a new window will appear on the right-hand side of your screen where you will be able to type in your question. Once it has been reviewed by staff on the call, your question will appear for everyone to view, and members of the audience are allowed to upvote or downvote particular questions they find relevant. We do plan to answer your questions by responding in the Q&A function or by answering them during designated sections of this presentation. Also, we just wanted to let you know that a copy of the presentation slides will go out to everyone who registered for today's webinar. And now I would like to introduce Sam Thompson, who is the Executive Director of the North Carolina Health Information Exchange. Sam most recently served as the Deputy Director for Program Evaluation at NC Medicaid, where he oversaw quality measurement, data collection, and internal and external program evaluation efforts. He also previously served as a lead evaluator at the NC Division of Public Health. Sam has worked closely with the NCHIA for several years and has championed the use of the Health Information Exchange, which is called NC HealthConnex. He championed it both for NC Medicaid and other healthcare community members. So he assumed this new role in March of 2024, and we welcome Sam today. So I'm going to now pass this over to Sam, who's going to give a brief overview of the North Carolina Health Information Exchange Authority.
Hey, good afternoon, colleagues. Thanks for giving me a minute to talk to everybody, Luke, before you and just got into the good stuff. So yes, as Luke said, I have had the privilege of serving as the Executive Director of the North Carolina Health Information Exchange Authority for about the last 18 months. But I've been, super enthusiastic about serving in this role and just the health information exchange itself, since I can remember, since well before COVID. I just believe that how important it is, based on my time at Medicaid and public health, to have the information on your patient, or your population in close to real time as accurately as possible, so you can provide more informed care, and close gaps as available, and network across that person's care team in order to provide them the best possible care. So there's a little history on this slide about how HIE came about. It was established in 2015. The system really went into effect in 2016. And at the time, providers who cared for patients that were paid for by the state health plan or by North Carolina Medicaid were mandated to connect by January 1st, 2023. That mandate has been softened a bit, and we're not holding providers to that level of account. That may come back into play. We're not totally determined. That'll be a decision that's made in partnership with the North Carolina General Assembly. So we do really want to get our mission and vision out there for y'all, and you can see that on the page. Our vision is to help North Carolinians live their healthiest lives by supporting equitable whole person health through data exchange services. And our mission is to promote the secure and efficient use of health information to improve healthcare quality and outcomes. So can you give me the next slide, please? So hopefully I didn't say all that with y'all being totally uninformed about what a health information exchange is. Probably why I said I was so enthusiastic about it is illustrated here. There is so much involved in caring for an individual patient and their health needs, and the more complex they are, the more data need to be exchanged in order to get to observe the problems that need to be addressed and get the right person there to care for that individual when they need it as soon as possible. Health information exchange is the tool by which that can happen, right? So we have a system that we kind of administer in partnership with SAS Institute and Carey. And we slowly over time have all these types of entities, like literally everyone listed on the circle here, contributing data to us so that we can then package that data, link it up, do entity resolution, so we know this Sam Thompson is that Sam Thompson. We put that all on a row, and make that available to other partners on my care team so that they can provide more informed care to me. Next slide, please, Luke. And so this, without going into a great amount of detail, because I think I've already exceeded my time, is why a health information exchange is so important, right? As I've mentioned already, it provides a more complete picture of a patient's health, reduce time for patients and staff waiting for records, provides near real-time event notifications, and hopefully some of y'all are using our NC Notify service that provides those notifications, helps with medication reconciliation, and I think this is an especially important one. It reduces duplicative testing and screening and helps close care gaps. So next slide, please. Back one. And so, yeah, this is really, I think, in a nutshell, why it's so important to be investing in and using the health information exchange, right? If you look at the model on the left side there, it's what we might refer to as like a spaghetti model. There's a little line going back and forth and looping around everything. It's not particularly organized, and every single entity has to have an integration with every other entity in order to share data, right? And this is the historical model, and this is still happening in a lot of places. And why we believe, HIE is such an important kind of step is that we can serve as that central hub. Any one of these nodes that's around the outside of this sort of rectangle can have one integration, and that integration is with the North Carolina Health Information Exchange. And all those other entities that make up the rest of that rectangle also exchange data through the Health Information Exchange. Great. Sorry, I muted myself by accident, but greatly simplifying the number of interfaces that need to be maintained. So next slide, please, Luke. That's Luke. I guess I'm done.
Thank you so much, Sam. We greatly appreciate that overview of NC HealthConnex and the North Carolina Health Information Exchange Authority, and we greatly appreciate you being here today. So everyone, my name is Luke Keeler, and I'm a Business Development and Outreach Specialist, and I joined the NCHIA in 2023. I have 15 years of experience working with communicable diseases in the public health field at both local health departments and at the Division of Public Health at the North Carolina Department of Health and Human Services. And so, okay, real quick, let me take Sam on. Okay, so we're going to talk a little bit more about NC HealthConnex and how it came to be. Sam already touched on that briefly, but the NCHA was created in 2015 by the North Carolina General Assembly to oversee and facilitate the creation of a modernized health information exchange, and that was to better serve North Carolina's healthcare providers and their patients. And this was basically a way to break down the silos in healthcare and improve that quality of care throughout the state. So we are part of the North Carolina Department of Health Information Technology's Data Division within the Enterprise Data Office. And it's important to note that we are a public-private partnership. So the NCHIA is the public part of the partnership. We are the government agency that oversees the Health Information Exchange. And SAS Institute, which is an analytics company based out of Cary, they are a technical partner. They are the private part of this partnership, and they oversee all the technical aspects of the Health Information Exchange. We also have a 12-member advisory board that is made up of various healthcare representatives from both public and private healthcare organizations, and that includes the DHHS Secretary, the DIT Secretary, and the EDO Director. So the HIA Act, or the mandate to connect to NC HealthConnex, it just requires that those receiving state funds for providing healthcare services, such as Medicaid and the state health plan, initiate their connection by January 1st, 2023. And providers could easily do that by signing a participation agreement, and that demonstrates a good faith effort to meet that connection mandate. We do have a lot of providers waiting in the queue, but as long as you sign that participation agreement, you're good to go. And we're going to kind of skip on through some of this because we do have a lot to cover today. But when you think about the vision of connectivity that kind of Sam talked about earlier, we are not only talking about connecting to providers across North Carolina, but NC HealthConnex also connects to healthcare providers electronically across the entire country. And that includes the national HIE called eHealth Exchange, which you can see all the states that are depicted in the light blue color. This also includes the Veterans Administration and the Department of Defense. And the eHealth Exchange uses a query-based process where you search for that patient within NC HealthConnex, but you're querying the eHealth Exchange for any relevant health data on that particular patient. And then you can view it in NC HealthConnex. So we're also connected to the patient-centered data home, which is depicted on this slide by all the states in dark blue, which also showcases both the eHealth Exchange and the patient-centered data home, which, as you can see, includes all 50 states. So now this doesn't mean that you'll have all patient information, as not all providers across the country are connected to their local HIEs just yet, but the goal is that we will get there one day. We are still in the process of getting many providers throughout North Carolina connected to NC HealthConnex. So again, not all patient data is live here in North Carolina either. So the patient-centered data home, it basically alerts providers when their patient is seen at an out-of-state facility, and this is based on a patient's home address and zip code. So when a patient, let's say, travels to another state like California, Texas, or Florida, or maybe even New York, and let's say they have an accident and are admitted to a local hospital, the home provider can be alerted to that fact by the information traveling back to the patient's home zip code into NC HealthConnex. So now let's talk about the connection process. The first step is to sign that participation agreement, and once it has been signed and executed, the participant will receive an email from NC HealthConnex that includes the welcome packet that has patient education information, some FAQs, and talking points to educate their staff and their patients. So that gets up to the number 3 that you see here on the screen, and at that point, the participant can begin enrolling in our value-added services. And that includes the clinical portal, which we call NC HealthConnex, or NC Notify, which is our event notification service. They can also enroll and have their direct secure messaging or DSM set up if they don't already have a DSM account through their EHR vendor. The great thing is they don't have to be live and sending data before they can access our services. As long as a participant has a signed and executed full participation agreement, they do not need to wait until they have a live connection to take advantage of our services and access the clinical portal. And then, of course, once it is the participant's time in the queue, they'll receive an email from us asking them to complete the connection scoping checklist. And then we'll move them throughout the process of connecting them when they're live in production. And of course, during this entire process, they always have access to support from the SAS HIE Help Desk, as well as the NC HIA as well. So now let's take a look at the privacy and security of NC HealthConnex. We are compliant with all federal and state privacy and security laws. Information is encrypted and sent over a private network. Information will not be sold or shared outside of those that have entered into that HIPAA-compliant data sharing agreement with the Health Information Exchange Authority. And as always, the data is encrypted and sent over a private and secure network. You can see linked on this slide is our privacy and security policies, which are also available on our website. It's just important to note that we do not accept 42 CFR Part 2 data, which is substance use disorder treatment data. We also don't accept psychotherapy notes at this time. That doesn't mean that behavioral health providers do not have to, connect. They're still a mandatory provider. It's just that, you will not see substance use disorder treatment or psychotherapy notes within the NC HealthConnex. Behavioral health providers still submit clinical and demographic data and for their patients. And eventually, though, we do hope to be able to accept 42 CFR Part 2 data and psychotherapy notes, but at the moment we just do not. So let's talk about the patient opt-out process. North Carolina has been an opt-out state since 2012, and that means that all patients are opted into the health information exchange for HIPAA-approved treatment payment and operation purposes. And that includes for all types of information exchanges, both public and private. And the Health Information Exchange Act also requires that participating healthcare providers, provide education materials to patients on the benefits of the health information exchange and their right to opt out of the HIE. You can see there is a list of resources provided here on this slide. They're also available on our website. And so just to explain this a little more simply, the mandate, sorry, that's our main line. So, you know, the mandate, of course, is for all state health data that is reimbursed by North Carolina State Health Plan or Medicaid or state-funded grants must be sent to NC HealthConnex. So, for example, I'm a state employee, so all of my data is inside NC HealthConnex, or should be, as long as my healthcare providers are connected and submitting data to NC HealthConnex. But if I did not want my data to be viewed by other providers, I could go onto the website, find the opt-out form, print it out, fill it out, mail it into the NC HIA, and the HIA will process that form, and then my data will be suppressed from view. But it's important to note that the patient filling out the opt-out form does not prevent the provider from submitting the data. It just prevents that data from being viewed by other providers. So as the provider, you are still required to submit that patient's health information, even if your patient informs you, that they've opted out of NC HealthConnex. Now, if a patient decides that they would like their providers to have access to their health information data, they can always fill out the same opt-out form and just put, that they want to resend their opt-out, and then all the health data will once again be available to providers. And since it's always been submitted to the HIEA, it'll still be there when they if they decide to opt back in. So now we're going to talk about how the exchange of health information actually works. So the provider, will enter that patient information into the EHR if this is a unidirectional connection and they decide to have a submission-only agreement. So the information is automatically sent to the NC HealthConnex through their EHR vendor. It's stored in our central repository, but again, the data does not flow back to their EHR. And this is a submission-only agreement. And that just means that the provider's only submitting the data that is required to us, but they do not have access to the clinical portal or NC HealthConnex, and so they can't view that data. This is another unidirectional connection, but with a full participation agreement. And this provider, they'll still enter the information to their EHR just as they normally would, and their EHR vendor then sends that information to NC HealthConnex. The information, as always, is stored in our central repository, and the data does not flow back to their EHR. But because they have a full participation agreement, they, as the provider, can then access that information within NC HealthConnex via a web browser. So they'll be able to see not only information they've submitted, but also the patient's information from across the state and all the other providers that they have visited. And they'll do that by accessing the clinical portal in a web browser. So our other type of connection is a bidirectional connection. And this is someone with a full participation agreement, and they still enter that information into their EHR as they normally would. The EHR then sends it to us. Sorry about that. And so with that EHR though, but if they haven't bidirectional capability, they can actually query and search and see NC HealthConnex within their own EHR. So the provider does not have to go to separate web browsers to view the patient's health information from other providers. And this eliminates having to toggle between both your EHR and our clinical portal. So if you are interested in bidirectional connection, you can always contact your EHR vendor. Now, just note that we, NC HealthConnex, or I should say the NC HIA, does not charge anything for our services, but the EHR vendor may charge for any additional capability. And this does include for bidirectional capabilities or connections, as well as if you're going to want to filter data, for example. We also have single sign-on, or SSO, and that's where the clinician can go to the clinical portal through their EHR and sign on using only one username and password. And this is like a pass-through and would allow you to view, the NC HealthConnex clinical portal without having to sign into a totally separate system. And this is just something you would be interested, you have to also reach out to your EHR vendor to set up. So what you see here are the data targets, meaning that we aim to collect the data you see on the screen. However, we do understand and we do realize that not all providers collect all of this information. Hopefully one day, though, all the information that is kind of required will be collected. It will be standard. We ask that you send the most robust data set that a provider is capable of sending, and especially with the information that they are collecting. So once again, we do not collect 42 CFR Part 2 data or psychotherapy notes. So in the dark blue, you see the patient information like demographics, and that's with the patient ID, date of birth, the gender, the race, the ethnicity. In the green, you see the encounter information, and that would be like the date of the visit, reason for the visit. And then in the light blue, you see the clinical information, and that's like the vital signs, allergies, procedures, labs, and medications, among other important information. So please note that all this information is listed in more detail on the onboarding packet for NC HealthConnex and also lists all of those technical specifications. So now we're going to review some of our suite of services. And there are multiple ways to utilize NC HealthConnex, but to get the best value, you will need a full participation agreement. So with a submission-only agreement, you meet the mandate by sending the data from your EHR to NC HealthConnex, but you don't have access to the clinical portal or any of our other services. And that's what you see on the left-hand side of the screen. But with a full participation agreement, you'll be able to see what the data that other providers are submitting to NC HealthConnex on both your patients. And again, it's only if you have a treatment relationship with that particular patient. And all this information that you see with a full participation agreement is listed on the right-hand side of the screen. You'll be able to use any of our value-added services like NC Notify. That's our event notification service for admission, discharge, and transfer alerts. You can also sign up for our direct secure messaging service to send direct messages to other providers to communicate with them about patients you're working with. We do have connections to other public health reporting, like submitting your vaccination and immunization records directly to NCIR with a pass-through through NC HealthConnex. We also have the diabetes and stroke registries, although they are more for public health and DHHS. But by using our service, it helps you meet promoting interoperability and meaningful use quality measures. And of course, you will have access to any type of training from any of our team members. So NC Notify, it's basically one of our flagship services, and it's just one of the services underneath the NC HealthConnex umbrella. So this slide just shows the overall goal of NC Notify service, which is to keep your providers and care teams in the know when events take place with your patients and when they receive care outside of their normal care network. So basically what you see here on the screen is just an illustration of that. So starting at the top, we have that greenhouse, and that represents your organization, and the patient is shown in purple here. And they're the ones who are assigned to your facility. And we know about this patient because either when you enrolled in NC Notify, you completed the paperwork and you created a patient panel for us to monitor those particular patients for you, or you're already connected to NC HealthConnex, and so we know what types of treatment relationships you have with your particular patients. And so we can automatically send you those notifications in near real time, letting you know in some high-level details about that particular visit when your patient went to the hospital, for example. And again, this comes through ADT messages when they are sent to us from any provider or especially hospitals. So in this depiction, when the patient went to the emergency department, they had an x-ray along with some other tests, and that represents the ADT message that is sent from the facility where the patient was seen to NC Notify. And once our system flags that alert, our system will match the patient with our facility and immediately send you an event notification to your NC Notify dashboard. Once you receive that message, that'll allow your team the opportunity to go ahead and provide any type of follow-up care or reach out to that patient whenever however you feel is most appropriate to treat them. So some of the benefits of having NC Notify is that providers get notified when their patients receive care in other settings, and it helps, with scheduling follow-up appointments with patients for traditional care management. It helps them follow up on medications that were prescribed or other discharge instructions. Also provides insights to help with continuity of care and reduce avoidable readmissions. Also provides insights into achieving those financial goals under the value-based care contracts. And it can assist with compliance with state and federal quality initiatives, including meaningful use and promoting interoperability. And another service we provide is Direct Secure Messaging, or DSM. It is basically a secure email service that allows providers to message other providers on a secure network. Most providers actually have Direct Secure Messaging, or DSM, through their EHR vendor. But if you don't, we do offer DSM within the NC HealthConnex clinical portal at no cost to you or to your organization. And this does give providers a way to message other providers if they have questions regarding, patient care, or to securely send PHI. So just for example, if a primary care doctor sends a patient for an MRI and they want to ask that radiologist to be able to see that information after the fact, they can message that provider with direct secure messaging and ask the questions they have about the MRI. Just to reiterate, DSM is similar to email, except that it is secure and it is encrypted. DSM does allow providers to securely send PHI, and we also have developed a statewide provider directory that includes neighboring states, so you can get those direct message addresses from other providers in other states as well. And this is just an example of what the DSM message board looks like. It looks very similar to email with, that you would have with your multiple folders, including your inbox, your sent folder, your deleted folder, and your drafts. And you can click on compose to create a new message and fill in the other providers' DSM address and then send that information securely encrypted. One thing to remember is that, again, we do not accept 42 CFR Part 2 data or psychotherapy notes. So this is where DSM can be used and be really helpful because you can attach that information into a DSM and send that securely to another provider. Also, DSM can be used to attach documents and images to send to providers, because we don't currently ingest images like MRIs or X-rays or CT scans. So if this is something you need to view or you make decisions about for your patient's health, you can request the images. Just remember that, the descriptions of the images or the reports of the images will be in NC HealthConnex. So again, just to review of some of the benefits of using our services, that utilizing that clinical portal, providers can review hospital information to help them meet the parameters of a Medicare TCM follow-up. NC Notify can also alert providers that their patient has been admitted, discharged, or transferred to other facilities. That also helps with the timely follow-up for both Medicare TCM and Medicaid TCM. And also with the high utilizer alert from NC Notify, providers can help provide that management for beneficiaries that have high cost needs. And you can also use that direct secure messaging inside the clinical portal to coordinate that follow-up care and make referrals and share images. So now just quickly to talk about some of the training. We do offer multiple training opportunities for our participants. We have 7 online training modules you can view or request from our website. They are linked here on this slide. The training modules are excellent and help you become more familiar with our services and how they work. We also offer live virtual trainings with one of our business development outreach specialists, and that'll help show you how to use NC HealthConnex, for example, with a clinical portal demo. You can fill out a training request form, linked here on this slide, also available on our website. And this is actually a booking link that allows you to quickly find a day and time that works best for you and your organization. And then twice a year, we also offer teletown hall webinars and office hours that you can sign up for and join. All right, so now I am going to do a clinical portal demo quickly to find some information within our service or site. So the one thing you can click on is go to our website, hie.nc.gov. You can also go to nchealthconnex.gov. And then here, when you get to our main website, you can see the clinical portal login. You can click here to access the portal, and then I would encourage you to star it as a favorite so you can easily access it at a later date and time. All right, so I am going to log into the demo environment so you can see what it is. One important thing is just always, this is our notification section where important information will be listed. So just make sure to review that when you sign in. Also, there can be announcements that are important to read, and of course the legal notices. You'll want to log in, making sure that the domain is listed as HS default. Some individuals will have multiple types of domains, but always make sure it's just HS default. You want to put in your username, your login, sign in. The majority of people do receive this internal error message. Know that that's okay. Just if you refresh your screen, it'll take you back to the sign-in page, log in once again, and that'll take you to the clinical portal. You'll get the disclaimer message, and that is how you know you have arrived and you've signed in. It just talks about how we do not collect 42 CFR Part 2 data or psychotherapy notes and the physician's responsibility. So if you disagree, that'll take you back to the sign-in. If you agree, it'll move on to the portal. This is the global menu here on the left-hand side. You can expand it to see more information. Not all of these options will be here for everyone. So for example, if you are the participant account administrator for your organization, you will have access to this tool. But if you just have the PAA role in your organization and you don't have access to the chart book, then you will not, or the clinical role, I should say, you will not see anything else beside the PAA tools tab. And if you are just in the clinical role, and you aren't the PAA for your organization, you won't see the PAA Tools tab. So in this case, if you're searching for a patient, you'll want to click on Chart Book. The search will come up. The easiest way to find someone is the more information you have on that patient, the smaller the list will be. If you just put in your first name, your last name, and date of birth, or just first and last name, you're going to get lots of individuals with the same name or similar names. So it's important to put in as much information to look for to limit your results, so you don't have to search through a bunch of individuals. But in the case if you do know the medical record number and the assigning facility, you can put that information in. And one thing I just want to point out is there is a difference between the medical record number of the facility you may be looking for, if it was Duke Health or UNC, compared to the master patient index number. So this number here is what we call the master patient index, and that is the number that we assign to that individual no matter what facility they attend to. So we have a matching process that comes through. So we get information from providers across the state. Each system has their own medical record number. So in this case, we have UNC medical record number for this patient, Duke University Health System medical record number, and it all filters in, and due to patient matching, we give them a master patient index number. So that is what this number is. So please don't confuse it with the MRN. So when you're looking for a patient and you haven't yet treated that patient, you'll need to declare your patient relationship. You'll want to click on this, select the reason for your visit, the reason for opening this patient's chart. I'm a clinician treating this patient. I'm providing care coordination, conducting a quality audit check, or conducting a privacy administrative audit. So we're going to declare our relationship with that person, and then you'll notice that MPI number has now been highlighted. It's underlined, so you can now click on this individual. But first, of course, you can always check the name, gender, date of birth, and address to see the information and make sure it is the correct person you're looking for. You can minimize the global menu, to have some more screen on your, more visibility for the whole chart book. So you have a menu here that you can look through. The main clinical summary is listed here. The top 5 allergies, top 5 medications, documents, labs will all be listed here. And they generally are in the most recent order, from the most recent to the oldest. You can sort this and change that to, if you want to look at the oldest first, however you'd like to filter that data. Anything that you see with a blue ellipses, either vertical or horizontal, means that you can click on that, and that will provide you more information. You can click through each of these, whether it's a condition, allergies. If you're want to search for something, you can easily type in what you're searching for, and out of all the information, this is just a demo, so there's not actually a lot of information, but generally if you're looking at a patient's health history, it's going to have a lot of information, so the search it can come in very handy. Each category, for example, medications as well, also has search functionality, so you can easily find more information quickly by searching. The documents is where you'll find the continuity of care documents. Anything, for example, that comes in from medical visits, this is where the majority of the information you probably are looking for will actually come in, and it'll have the full information from that patient's visit and all the information that you can search through to find. You'll click here to go back to chart. You can continue on through other information, whether it's immunizations, the lab results. Remember that anything in red is abnormal. Again, you can still search for labs too, which will help make things a little quicker. We also have diagnostic studies, procedures. This is where you'll see some of the ICD-10 codes. Now remember that some of the codes will be listed here, but other times it will not. It will just be a description. Histories, this is really important, and this is where Jess is going to talk about a lot today as well. When we talk about the social determinants of health, or the health-related social needs, and that's where you can find out information regarding an individual's living situation, whether it's also their health-related social needs, and that could be from housing insecurities, food insecurities. You can also see the questions that were asked, what a patient responded with, what facility asked the questions, and when the questions were asked. So this may not be something that you need to ask the patient if they were just seen 3 days ago at another healthcare facility. So, and it can be beneficial for you to follow up care with them because maybe they weren't followed up with at the other facility regarding the health-related social needs. So it's important to review that information. Also, there are encounters, appointments, and demographics. This is where you'll see the most recent updated information. You can look clear for other addresses, and you can get their emergency contacts listed here at the bottom. One other thing I did just want to show, I'm going to have to move this, sorry. Right here is where if you want to get to the patient reports, this is how you will access and view the entire full patient record or be able to print or save a document. You'll go into click on the View as Patient Summary PDF version. Right now this is HTML, so if you want to download the HTML version, you can input it into your EHR. But in this case, if you want to print something, you'll go to the PDF version. You can do the expanded report. You can also go to the pharmacy report to look at medication dispense data. You can see the smaller report is listed at 68 pages, but when it's been expanded, it's now at 115. I am very sorry for having that phone line be connected right now. Please forgive me. So when you look through it listed back to 115 pages, you can scroll through and view the information. You can search for that information. You can also print the information here. And now I'm going to continue because we are running short on time. So I'm going to go ahead and hand this over to Jess. So Jess Kuhn, she is the HIE Medicaid Services lead, and Jess joined the NC HIA in August 2024 to oversee the design, the development, and the implementation of Medicaid-focused use cases aimed at improving quality and population health. Jess served as the quality measurement lead at NC Medicaid, where she analyzed performance metrics and developed quality measures sets to guide program evaluation across the NC Medicaid population. And
awesome.
So
thanks,
welcome, Jess. Yep.
Awesome. So I'm going to just give a bit of an overview of the HIE Medicaid Services Program and then a few brief updates, knowing that we'll continue sort of sharing information out as we work through this long-term work plan. So if you go to the next slide, this is just a little bit of the information that I'll cover. And so we can go into the overview to start. You want to go to the next slide? Perfect. So we already touched on this a little bit. I think Sam talked about it at the top of the call. But one of the main drivers between the NC HIEA's partnership with NC Medicaid is the Statewide Health Information Exchange Act, which requires healthcare providers who receive state funds, so that includes Medicaid and the state health plan, to share clinical and demographic information with NC HealthConnex. That said, as Sam alluded to, there's been a long-standing relationship between the HIEA and NC Medicaid since the establishment in 2015. Some examples and more recent examples are during COVID. The HIEA helped assist with surveillance, things like checking on hospitalizations for COVID patients, as well as vaccination uptake and diagnoses of COVID, as well as during Medicaid managed care launch in 2021, the HIEA was able to support with getting more up-to-date contact information for beneficiaries to support the high-risk patients' transition into managed care, so that staff at Medicaid were able to actually get in contact with folks and let them know that their benefits were going to be changing under managed care. And so for that example, we actually saw a 2 times increase in being able to contact those beneficiaries because their information was more up to date in the NC HealthConnex system. So there's lots of great use cases, and there's been a lot of partnerships on top of being driven by the Statewide Health Information Exchange Act. And so if we go to the next slide, that has led to the development of what we're calling HIE Medicaid Services, or HMS. Anybody that's been in the healthcare space for a while knows we love acronyms, and so this was just a chance for us to create another acronym. But really, HIE Medicaid Services is a way to formalize the partnership between the HIEA and NC Medicaid, knowing that we've had a lot of great use cases. It's been a very long-standing relationship, and so this is just how we're coining sort of all of that work that falls under that umbrella. So the vision of HIE Medicaid services is to leverage NC HealthConnex to support North Carolina Medicaid's quality and population health efforts by improving data exchange. What I'll be talking about today are 3 specific use cases that we're working on right now with NC Medicaid to support digital quality measures, health-related social needs screening data exchange, and care management data exchange. That said, like I mentioned, there's a lot of other work that's been going on. The HMS team doesn't function as a standalone unit within the HIE, but is actually made up of staff that are embedded across various HIEA teams, as well as with folks at NC Medicaid. And so we all are aligning our efforts to support this program. And this work is being funded via CMS from an advanced planning document. And so we are able to receive enhanced federal match in addition to state share of that work. And so what you can see on this slide now is just sort of a visualization of this program. So our one solution is NC HealthConnex, serving as a centralized data aggregator for the state. We have our 3 use cases: digital quality measures, health-related social needs screening, and care management data exchange. And it's supported by many partners that are on sort of that bottom tier there. There are also folks involved that maybe aren't explicitly mentioned on this slide. For example, we work really closely with folks at NCQA, talking about the quality measures use case, or the Gravity Project talking about health-related social needs screening. But that's in addition to the many other partners that often are supporting this work or consulted as we're making these decisions. So we'll dive in first to the digital quality measures use case. If you're wondering what digital quality measures are, you might have heard them referred to as DQMs, but they're really just quality measures that are built out in an electronic format, being able to apply measure logic using standardized codes and formats. This allows the measures to not only include additional data sources beyond just administrative data, like classic quality measures, so think about administrative claims or encounters data, but it expands to additional data sources, as well as allows for more near real-time results because the inputs are updated more frequently. So if you think about clinical data, as clinical encounters happen, digital quality measures are able to actually run measure logic on a more near real-time fashion to then update, and you can track progress over time, leading to increased care gap closure and time to be able to monitor those results and make changes. So if we go to the next slide, so CMS is pushing the adoption of digital quality measures and actually has a goal of transitioning to digital quality measures for all of their reporting programs by 2030. And so part of this work, in addition to wanting more robust and accurate quality measure results, is actually meeting that timeline. And so what's on the slide here is just a depiction of the system that we're trying to stand up. So we're already ingesting into NC HealthConnex the provider organization's electronic health record data, and that's really the clinical data that we're receiving. We're also actively working and in some cases already receiving some of the claims data from NCDHHS via their systems, as well as the encounters from the health plans. And what that'll do is sit within NC HealthConnex, and we'll be able to use a DQM engine to actually apply the measure logic and share out quality data with various partners. So some of those are listed on the slide here. That'll include health plans, NCDHHS, which includes Medicaid, as well as individual provider organizations and health systems, so that they'll be able to see care gaps that might be able to be closed with certain actions. Our initial focus for this work, sorry, Luke. Our initial focus for this work is on 3 priority quality measures that have been a priority for North Carolina Medicaid due to them being in various measure sets, such as CMS core set reporting. 2 of them are HEDIS measures, so the health plans are reporting on those for health plan accreditation. Some of these measures are also AMH measures, so can be incentivized via value-based payments. And so the 3 measures we're starting our focus on are controlling high blood pressure, glycemic status assessment for patients with diabetes, and screening for depression and follow-up, knowing that none of these measures can be calculated effectively without the inclusion of clinical data. So we're really not able to do an adequate job of measuring these relying just on administrative data. And since these conditions and measures are really important, this is kind of where we're starting with the goal of standing up a system that will be able to support additional measures beyond these three. So there are various aspects of the DQM use case that we're working on, again, sort of standing up in formality. The first is working with our participants of NC HealthConnex on data quality. That would be serving as that sort of first input section of the clinical data that's being submitted to NC HealthConnex. So this includes things like data quality improvements on the clinical data that's being submitted. At a high level, this work includes things like the HIEA and SAS teams doing exploratory data analysis of the data that's being submitted by participants, engaging directly with participants to make those improvements, and then doing continued monitoring and engagement to see how we're able to make those improvements in the data. What are we really looking at is the technical connection, so how the data is being transformed across the digital landscape, as well as potential workflow changes that might need to be updated. So this might be ways that the data is being input into electronic health records by personnel, or being collected or asked about. And then the second piece of this work is NCQA's data aggregator validation program, which is really just an end-to-end process for us to evaluate clinical data streams to ensure that the data that we're receiving for quality measures is accurate and dependable. And so those two items are really our area of focus directly with participants. That said, just like on the last slide, there was sort of the DQM engine cylinder. Running digital quality measures is an aspect of this use case. And so we are working on looking at the different functionalities of tools that are available and how we might be able to leverage those. And then just thinking of the work that we're doing with our participants, our goal is that by September of 2026, so a little bit of over a year from now, we'll have successfully worked with 10 provider organizations for their technical and workflow implementations of the data quality aspects of the DQM use case. We can go to the next slide. So next I'll jump into the health-related social needs screening use case. So this diagram here is really just a future state of what we're trying to build with the health-related social needs screening use case. The goals of this use case are to improve access to screening data, really developing the capabilities to pass beneficiaries screening data on health-related social needs across health plans, providers, and NC Medicaid. So all permissioned users that are involved in somebody's care would be able to see that data. To reduce administrative burden for care managers and providers who may be currently doing duplicative screenings because they don't have access to data. And then also in the same vein, improving the patient experience. You know, we know that a lot of the questions that are often asked are sensitive. And while we want to gain a deeper understanding of beneficiaries' unmet health-related social needs, if we're able to reduce the number of times that we may need to ask a beneficiary those questions, or we're able to use that information in certain settings to get them access to resources, that's absolutely something that we'll want to support. So what we're currently focused on right now is this number one at the top of the data flow diagram, which is pulling in to NC HealthConnex health-related social needs screening data from provider organizations, EHRs. We'll then move into number two on the bottom there, which is also pulling in the screening data from the health plans. We know that the Medicaid managed care plans in North Carolina are screening these beneficiaries. So we'll work on pulling that data into NC HealthConnex as well. And then that data will be made available to the entities that are on the right. So that'll include NC Medicaid as well as NCDHHS proper, the provider organizations, and the health plans as well, so that all of these permission entities will be able to access this data. And some of this is already in flight right now. As Luke shared, that data is currently available for providers via the clinical portal. We are working on also setting up a system for providers to be able to query this data and retrieve it via FHIR. So we can go to the next slide. So the work that's being done for this use case was actually built on a pilot that was conducted over the last few years to support the exchange of screening data via NC HealthConnex, specifically by developing standards across participating hospitals. And so our participating hospitals for this SDOH Link data exchange pilot were Duke and UNC, and these entities worked with staff at NCDHHS as well as the HIEA to look at 6 questions from the NCDHHS standardized screening questionnaire that covered food, housing, transportation, and utilities, translating that data. So of those domains, the questions that were being asked within the Duke and UNC system, translating those questions and answers into standardized LOINC codes, and then using Health Level 7 admission, discharge, and transfer, or ADT messages to transmit that data to NC HealthConnex. And so this was a really successful pilot. There were a lot of lessons learned that we're now spinning up into what I'll talk about in a moment, which is the Early Adopters Program. But we're building on the lessons learned and the success of this pilot to be able to use these ADTs and leverage them as the vehicle to get this data to NC HealthConnex. We can go to the next slide. So this is what Luke has already shown, and I talked about it a moment ago, but the standardized HRSN data is currently available in the social determinants section of the clinical portal, which is super exciting. That said, we still have a ways to go, and we're also onboarding additional organizations to this. So as we collect data from additional organizations, that information will be populated in this section here. And then similar to the DQM use case, we do have some goals that we're shooting for by the end of September of next year, which currently is us onboarding 21 additional provider organizations, having their data ready to go in the clinical portal. So that is what we're shooting for right now, is to increase the data to that magnitude. The next piece is our HMS Early Adopters Program. And so the Early Adopters Program is really just a way for us to recruit initial voluntary Medicaid provider organizations to participate in the 2 use cases that I just talked about, the health-related social needs screening use case and the digital quality measures use case. These organizations, we know that in their work with us, especially as early adopters, there's going to be a lot of upfront work, time, resources, and potential costs that they may face. And so this program just gives us an opportunity to financially support these organizations by giving time-limited direct payments that are paid out upon completion of agreed-upon technical and workflow milestones. So we can go to the next slide. So we actually had already opened up the Early Adopters Program for applications earlier this spring. And in doing so, we developed some criteria for participation, which includes serving Medicaid beneficiaries, having a full participation agreement with the HIEA, and being connected and sending data to NC HealthConnex, as well as some additional criteria for each of the use cases. For example, if you're participating in the health-related social needs screening use case, your organization needs to be either capable of collecting HRSN data or already collecting that data and storing it in the EHR. So like I said, we have already received some applications for this program, and we use various factors to prioritize folks' inclusion into the program. So these include things like being an advanced medical home or a tailored care management provider, being a rural provider, having a high number of Medicaid beneficiaries or a high Medicaid claim count, and other items listed on the slide here. And then we have various amounts, just the one more. So we have various amounts that are available for participation in the use cases. So it's $20,000 total in incentive funds available for the DQM use case, split up with half being available for the data aggregator validation program participation and half for data quality improvements, and then $11,000 for transmission of HRSN screening data to NC HealthConnex. And so I kind of already talked a bit about our progress to date, but we've been sharing information about the Early Adopters Program for some time now via newsletters and a Medicaid bulletin. Some AHEC coaches have gone out and shared information about this. And we also had 2 information sessions in April. That said, we have a current cohort that are listed on the slide here for our HRSN screening and DQM use cases. We have some additional folks that are in the pipeline for these cohorts, but their attestations may not have been finalized yet, which is why they're not listed on the slide here. In terms of next steps, we're going to be scheduling kickoff calls with these participants to begin the work for these use cases. However, we are actively recruiting at all times for the future cohorts of the early adopters program. So we have a Microsoft form that's available on our website. If you're interested in participating in the early adopters program, feel free to fill that out. And if you've already filled it out and aren't a part of cohort 1, your application will automatically be reconsidered for a future cohort. And our goal is to launch cohort 2 sometime in the spring of 2026. So we can go to the next slide. And so I already kind of shared some of this, but the Microsoft form is linked here as well as on our website. So when you get these slides, you'll be able to access this. We also have some information about the use cases and some FAQs available on our website. And that will also be where you'll be able to find the most up-to-date information about this program. And then given time, I'm going to just, we can go to the next slide, but I'll just say, so the care management use cases are sort of another bucket of work that we're supporting with Medicaid. It is very operationally focused, really just looking at trying to reduce the one-to-one interfaces that currently exist between the health plans and Medicaid providers by leveraging NC HealthConnex as a central aggregator. We aren't seeking any early adopters for this use case, in part because, again, it is very operational and about the pipes of passing data around, and less so about working directly with our participants and providers. So I won't spend a lot of time here except just to say that this is another area of work that we are working actively on with NC Medicaid. And here is the website, as well as the program email for the HIE Medicaid Services, or HMS, if you have any questions. And Luke, I'll turn it back to you.
Thank you so much, Jess. I'm going to go ahead and release a poll, so hopefully you'll be able to see it within the chat and then respond to it as well. And I want to thank Kim for putting links within the chat during our discussions of when we were speaking about different topics of how to connect both privacy and security and the HIE Medicaid services. So thank you so much for that. It looks like in regards to questions, we had one in the chat, one in the Q&A. It was, what do you do when you switch the EHR vendor? Do you need to sign another participation agreement? And no, you do not need to sign another participation agreement. You'll just need to inform the NCHI that you'll be switching to a different EHR vendor. And you can do that by emailing the HIE at nc.gov. And we will be able to move forward from there. It will be slightly different if you are already connected and submitting data versus if you are not yet even connected. Because if you're not yet connected and submitting data, there won't be any issue at all because you're not currently connected. Are there any other questions? I don't see any other question in the Q&A at this moment, but if you do have a question, please put it in the Q&A so we can get to it or at least respond to it when we send out the slides and a follow-up to this meeting. We did record the meeting today, so that will be probably listed on our YouTube channel or for you to view at a later time. And we are basically out of time. If I do not, but we can stay for any other questions if anyone has them. If not, I just wanted to go ahead and again, also, if you have any questions in the future, you can also contact us at the HIA at nc.gov, and you can always visit our website, nchealthconnex.gov. And so we want to thank you all so much on behalf of the HMS program and NC HealthConnex and the NC HIA, and also AHEC, who originally set this meeting up. We thank all of our partners, and we thank all of you for taking the time to meet with us today. Hope you have a great rest of the day and a great rest of your week. All right. Bye-bye.